Fellow Zimbabweans, I have spent this morning at Parry Hospital and have discussed and researched the current crisis with those who know. What a mess. As if it were not enough that our health system was already dysfunctional, the product of years of neglect and mismanagement. Now it is in chaos. First with the doctor's strike, and now with the nurses' strike. With the large majority of our medicines in our hospitals being donated, processes and systems ineffective, corruption in the health procurement system rampant, and the entire workforce demotivated and now largely hardened to the suffering and death all around them. What has become of Zimbabwe's health system? It was once a shining example in the region. Why are we in this situation? The answer is simple. At its root, this is about ineffective leadership. Our medical professionals are underpaid, and the entire system is underfunded. The health sector is largely neglected. It is the same disease that afflicts every single government department, the same disease that affects our entire nation. When medical professionals strike, a polarized argument always develops. On the one hand, some say that it is morally wrong to abandon one's post when the result is that people will die. How could the pursuit of a pay increase or allowances ever justify such a move? There is some merit to this argument. On the other hand, there are those striking who would say, but we have raised our grievances so many times and no one is listening. For how long should we tolerate such a situation? 1 year? 2? At one point in 2008, it was costing many medical professionals to attend their workplace, as their pay would pretty much only buy a pie and a Coke. Hospitals such as Parry have become mornings-only institutions, as medical professionals moonlight to make ends meet. Being a doctor or a nurse is a calling, yes. But when there is no food on the table at home, what does a mother nurse say to her hungry child? This is also a powerful moral argument. And so we are in the situation that we are in today. What are we to do? For anyone that has ever worked a job, they will know that as the leadership goes, so goes the organization. This is true of a company, just as it is true of the health sector and of government at large. The fix, as we in the Build Zimbabwe Alliance have been saying consistently over the past months, is to elect honest, accountable leaders who can implement sound policy. As the electorate, you and I are responsible for making this happen. We are also responsible for softening our hearts to the plight of our fellow Zimbabweans, for speaking up when keeping silent would be much safer, for leading from the front if that is what we are called to do. But we are where we are. This is a crisis. What should we do now? To the nurses represented by the ZIMA, know that we are behind your just cause. As you know, the death rate rises dramatically when you leave your posts. There is no way the government can recruit enough nurses to cover your absence. Today, someone has died that need not have died. We urge you to come back to the negotiating table, knowing also that a speedy resolution of this crisis will save lives. We also encourage you and other Zimbabweans to elect the right leaders at the next election, who will make the best decisions for you and for the patients we know you care about. Until then, let's all work to make sure that no one's mother, father, brother, sister, or child dies needlessly. To the government, we would urge you to immediately take effective emergency measures whilst you resolve the crisis. Re-engage the nurses immediately as you initiate an independent arbitration process. We are here because of the mismanagement of the past. Management of the present crisis is entirely your responsibility. No one else needs to die needlessly